Hi, my name's Erin Wright, and this summer I interned at Raise the Bar Therapy Services. Raise the Bar Therapy Services is a clinic that strives to maximize movement, minimize pain, and improve overall quality of life. They provide physical, occupational, and speech language therapy that aims at getting to the root of the problem through holistic health practices. They provide a number of services such as sport medicine, surgery therapy, women's health and pelvic floor training, speech and communication training, feeding and swallowing therapy, myofascial release, and overall motor skill improvement, and much more. Individuals at all ages are seen at Raise the Bar Therapy Services, and whether it was working on motor skills, feeding in pediatric patients, helping gain mobility and strength after a sports injury, or even relearning other daily tasks after a stroke with memory care, Raise the Bar Therapy Services does it all. They also have a restorative tattoo artist that patients can make appointments with to cover scars or recreate realistic anatomic impressions through tattooing. In this picture here, it's the gym that pediatric patients get to use either to burn off energy, or sometimes they will do therapy in the jungle gym. So the office is funded through insurance companies after they receive patient referrals. Raise the Bar Therapy also accepts TRICARE and pretty much all types of insurance: Medicare, Blue Cross Blue Shield, Medicaid for pediatrics under 21 years old, and Humana, plus many more. And patients also have the option to pay out of pocket if they so choose. This is the office therapy dog, Leo. He is the sweetest dog ever, and he roams around the office, says hi to patients, kind of peeks in on different sessions, and they even use him in certain therapy sessions, including I sat on one appointment where they were trying to work with feeding with a pediatric patient who has a dog at home. So they wanted him to kind of be in the room to make sure that this child would be able to eat at home without being distracted by dogs or other things that were in the house. The founder of Raise the Bar Therapy is Michelle Beal. She is also an occupational therapist. Rich is the director of physical therapy, as well as Allison. And Allison, right before I left the internship, just was promoted to the pediatrics department. So she is also the director of pediatrics. Danielle Garino is the director of speech therapy, and she is who she was my site supervisor, and I really learned a lot from her, and I give her a lot of credit for kind of getting me interested in speech. They also have physical therapy assistants, occupational therapy assistants, and speech language pathologists that work alongside them, and speech language pathologist assistants who will go into the daycares around Hampstead and the Wilmington area. So some of my responsibilities at Raise the Bar Therapy were assisting with the management of children and adults during PT, OT, and ST. I sat in on a lot of sessions and assisted during those sessions by helping the pediatric patients kind of focus. I remember in one of my sessions, one of the kids just couldn't focus, and in order to get them to focus, I ended up doing some of their exercises with them and had to lay on the floor with them and kind of like roll around, and it was fun. I also assisted with sessions and kind of learned more about what each profession kind of does. I quickly learned that physical therapy wasn't for me. And I also learned that I really enjoyed working with pediatric patients. So I kind of hung out more with occupational therapy and speech pathology. I also helped with focusing on getting patients to meet their goals for the day, whether it was rolling on the floor, doing different exercises with them, or if it was just providing materials. I made a lot of materials over the course of my internship. I made a lot of speech sound cards. I made a board game that went along with one of the books that they read, the Brown Bear book. I also faxed and filed a lot of paperwork. I was able to get referring practitioners' signatures on a lot of the patient documents, and also cleaned and prepped rooms. That was a big thing, was making sure the rooms were clean for sessions and then also sanitizing them after the sessions. I also ran around the office like crazy, getting bed sheets, different things used in clinic, and washing and folding laundry. Some of the main CEIF public health domains that I fulfilled was health promotion and health protection. The main goal of the clinic is to promote health and give patients the tools that they need to positively impact their quality of life. And I think that that's the main takeaway from speech and physical therapy and occupational therapy. I had no idea kind of what it was. I always was interested in the dental field, and so going into it, I wasn't really sure what to expect. And I didn't realize how many, not necessarily disorders, but symptoms could be attributed to small things like tongue ties, for example. And I learned a lot about tongue ties. I also learned on like day one that my husband has a tongue tie. So that was like very interesting, and what kind of made me more interested in pursuing speech possibly. And so little things like that that can really impact someone's overall health and well-being is very interesting. And I think that that was probably one of the main public health domains that I not only learned but worked on while interning. This is my internship project. I made a pictures exchange communications book. I made different categories. So there's food, emotions, colors, like everyday items in the house or in the clinic. On the front of the book, that is where the kids can build sentences, words, express their needs. This book provides a means for nonverbal pediatric patients to effectively communicate their needs using pictures. So the front of the book, like I mentioned, provides space for the kids to build sentence, express their needs, and also help them keep a schedule. So if you see at the bottom, it says first, then last. A lot of the patients that we were seeing had a difficult time with scheduling and figuring out when they do certain tasks. So like we wake up in the morning, not at night. And so doing that kind of helps them build a schedule and become more confident in communicating. This also is a useful tool because it allows children to have their needs met, which can diminish frustration, outbursts, other behavioral issues. And hopefully over time, this helps them associate pictures with sentences and words and helps promote them to use their words later on in life. So my final thoughts overall, I really enjoyed learning more about physical therapy, occupational therapy, and speech language pathology. I formed a lot of friendships and connections, and I learned that I really love working with children. And I liked speech the very most. I think because of my background understanding of just dentistry and having a passion with dentistry, I didn't realize how much overlap there was, not necessarily just learning speech, but also like when I mentioned earlier, tongue ties and different muscles in the mouth. I think that's very interesting. One of the more difficult, or I guess my least favorite aspects, is working with elderly patients. I don't know what it is, but I have less patience for them, especially when they're frustrated and taking their frustrations out on me. When a child is having frustrations, in my head it's like understandable, they're kids, but it's difficult for me when it's an older person and it's targeted at me. But overall, I'm very thankful of the experience and opportunity to intern at Raise the Bar Therapy Services. Thank you.